chose neurosurgery as a specialty because in this specialty we have a huge opportunity to positively impact people. We see patients on the worst day of their lives, and we get to admit them to the hospital, and we get to see them recover, see them improve, and see them regain functions that they lost. And for me, that's truly rewarding to watch that improvement over time. The best part of completing my residency at TU of T is probably the opportunities that we have here at the university. We have a lot of opportunities to engage in research if we wanted to. We have opportunities to engage in educational programs and teaching if we want to. We obviously work with superb mentors who are world leaders and who engage us and push us to engage ourselves in the work that we do. It's a phenomenal place to train. When you look at the burden of surgical disease in the world, there's a huge burden in the developing world that's unaccounted for. Over 2 billion people in the world lack access to adequate surgical care. For me specifically, I'm interested in epilepsy surgery, and 85% of the global burden of epilepsy is in the developing world, with no adequate treatments or with a paucity or a shortage of adequate treatments in those countries. For me, doing global health work is an extension of the work that I do here in Toronto, or that I want to do here with the populations in Toronto. But because the magnitude of the disease is so much more in the developing world, there's an even greater opportunity to make an impact. I think being involved in the Global Health Education Initiative has given me a lot of tools to proceed forward with global health initiatives in the future. And I think it's also given me an opportunity to see the breadth of global health that's out there. Before starting this program, I think my view of global health was perhaps a little narrow, but by participating in this and by interacting with all the instructors and with all my co-learners who are in the Global Health Initiative program, I've really had an opportunity to expand my horizons and see exactly what impact I could do in the future in the field of global health. All of us are individual players, and our impact is relatively small in the greater picture. But the more people you have interested in global health, and the more people you have making small impacts in global health, when you look at all of those impacts together cumulatively, then you have a big impact. So I was just recently in Uganda working at a neurosurgical hospital, and this hospital is unique, but there's more of them that are starting to expand in the developing world to try to increase access to neurosurgical care to local populations.